I feel so grateful. We're guys 300. I want to give you like positive energy and positive vibes, and I'm so happy guys you're here. I'm so happy you invest time to watch me. I'm so happy I can be useful to someone. This is great, isn't it? So I am continuing my series of video talking about medical terminology for interpreters, and I advise you to listen to these videos while you're cleaning, folding clothes, or doing any kind of a home errands, because getting seriously into medical terminology, it could be kind of overloading, especially after a long day of interpreting or translating. Okay, so I want you to watch this video in a relaxing way when you do other things, because your brain and your memory have this magical, marvelous capacity to remember the things that you delicately serve to them. Okay, so we are going to talk again. I will share my beautiful paintings with you about, you guys get it, we are gonna talk about, oh my goodness, okay, here we can see it, gastroenterology. Yes, this is video number 2 talking about gastroenterology and digestive tract, and today this video we are going to talk about common problems in gastroenterology, in particular appendix, what are the symptoms, appendectomy, and the most common term that I guarantee you are going to use on a daily basis as medical interpreters. Okay, so I don't know if you guys remember the last time that we talked about gastroenterology and what is gastroenterology tract. The appendix is located on the right side of the of our belly button, on the right side. This is the large intestine, and on the right side, in the end of large intestine, there is located the appendix. Appendix is a small end part between 5 and 7 centimeters, and the function of it they haven't discovered yet, but inside the appendix there are different microbiological floras, which we don't know exactly what is the function, but let's talk about what are the problems that can happen with our appendix and what are the consequences. The number one, we can have a blockages. So these blockages into the appendix can create a different reactions that could be little and it could be light or very severe ones. Okay, we can have problems with our pressure, problems with the high blood pressure, inflammation, and if it's not treated, that can bring to very serious health and life-threatening complications. Because if appendix is very inflamed, it can create severe pain and other symptoms, which I'm going to talk shortly, but it can also explode. And this can create a very, very serious problem for our health, for our life. Okay, what are the symptoms? Of course, pain in the stomach on the right side, swelling of the abdomen, loss of appetite, nausea, vomiting, constipation, diarrhea, inability to pass gas, and a low fever. So in the beginning, these symptoms could be slight, or they can suddenly sharply appear altogether. This is a serious symptoms. Okay, the procedures. I'm gonna talk about the appendix procedures. So the procedures are depending on how severe the problem is. If we have a slight inflammation, or if we have explosion of the appendix or birth, or when the appendix break, that could be a different severity, and different how severe the problem is. It could be different, and it does depend what kind of a procedure we need to do. Normally when we have inflammation, it's very painful, or if it's abrupted or exploded or broken, we have a peritonitis, which is more serious problem. in the base of how long your appendix was burp or broke inside of your body, that substances, they call them the body poisons, because that substances that are located inside the appendix could be very seriously toxic for our body, and that's why they can bring to death. So in the base of how serious this and how long this process has been persisting, there is two types of removal. Appendectomy, it's removal of the appendix. One is called laparoscopic, and the other one is called open surgery. Appendectomy is very common procedure in medical interpreting, so guys, just listen and make sure you're ready to do it on your target language, whatever language is that. So laparoscopic procedure of appendix removal or appendectomy, it's the less complicated one. When we have inflamed or slightly ruptured appendix, when it's not so severe, laparoscopic mean that they create a small incision on the side of the body. They're very small cuts, and they use a special thing. Let me tell you. Okay, they after they make this incision, they use a special cannula that use it to put a special gas into the stomach, which is called, let me see, carbon dioxide gas they use to bulb your stomach, which to full space in between the organs. And then they use a small tube called a laparoscope, in the end of which is located a small camera and a light. Thanks to this laparoscope, they could see the organs and they could see where what is going on, and they can also remove these toxical appendix juices, if we want to call them, and also to remove the appendix. Normally they cut it with a clip. I personally have seen procedures about it, so it's not the most beautiful things to see. If you're not ready, you don't have to. But imagine they just clip this end of the appendix, they clip it, and they put a metal or a plastic clip there, and they remove the piece out. And if there is any liquids out or anything else, they suck it out of your body. When they do laparoscopic procedure, normally they use glue to glue these small cuts. When we do appendix removal open surgery or open operation, this is when it's more complicated. The appendix has been abrupted for quite some days. There is a lot of toxins that were released into the body, and these toxical liquids or substances, they can create a permanent damage on your internal body. So the open surgery for appendix removal is more serious. Normally, both of these procedures, the procedures are the same. Of course, the open surgery is more complicated. They sometimes do a partial hysterectomy or partial vasectomy, whatever is the internal organ. Sometimes they have to remove it in order to save your life. So having appendix problem it could be very complicated, very serious. Get ready to interpret for a gastroenterology for appendix removal. This is very often. Let's talk about the risk. As an interpreter, you gotta interpret. The risk of this procedure include bleeding, infection, injury of the nearby organs, and blocked bowel movements. There is another, they call perforation of the side organs and whatsoever, but this is the most common that you're gonna be able to interpret. Another thing that you need to know is pre-operation. They have pre-operation instructions, and normally those instructions are done by phone again. Pre-op instructions they call, and you interpret over the phone. The instructions are no eating or drinking 8 hours before the procedure. Normally they give you the before midnight, and they give the date and the time. Tell the doctor if you take any medicine, any prescription medical. So when they go for the pre-op screening, you normally pass medical history, and let me see. Okay, other medical history, prescription, any history of if you're pregnant, if you're allergic to any medicines, and if you ever had allergy reaction to anesthesia or dye, any bleeding disorder. As you guys know, any surgery include bleeding disorder. Do you have any bleeding disorder? This is very important question. And then in the end, are you going to have a family member or somebody who is going to drive you away from the procedure? I repeat, guys, appendectomy or a removal of appendix requires general anesthesia. General anesthesia means the patient is completely asleep. Normally it's between 45 minutes, but if it's very complicated case, could continue for several hours the procedure. And normally the patient get attached with UV that is intravenous, that is used to put fluids, and normally the anesthesia go through the IV. And also the medicine. Okay, guys, that was about gastroenterology, digestive system, and that was common complication. Complication number 1 or health problem is appendix inflammation or rupture of the appendix, and the complications and the symptoms. Thank you for being here. I hope this video was useful. Please like, share, subscribe, write me a comment. I send you a lot of smiles and positive energy. Thank you for being here. Have a good day. Bye-bye.